Hey, welcome to this video. Stop seeing just lines. Learning ECG interpretation is like getting a secret map to the heart's electrical activity. Let's unlock the code and save lives. What is an ECG? Basically, it is a graphical representation of the electrical activity of heart recorded by different leads or electrodes. Here is a picture and how many leads? 12 leads, 6 electrodes and 6 chest leads and 4 limb electrodes. So question is, where are the other two? The answer is 12-leaded ECG provides 12 unique views of the heart's electrical activity using only 10 electrodes placed on the body. This is the thing actually. Cardiac axis. Basically, analyzing cardiac axis is a fundamental step in ECG interpretation because deviations from normal range, left axis deviation or right axis deviation, serve as a critical diagnostic marker for underlying heart condition. So to detect deviation, we need to understand the axis deviation, and for this we need to know the normal cardiac axis so that we can interpret ECG quickly and correctly. In ECG, we should make sure that lead placement is correct and um, all leads are placed in correct way in correct place, and patient is in an anatomical position is perfect. These things. So let's think of a heart, and there are three leads: AVR, AVL, AVF. A for augmented, V for voltage, and R for right, L for left, and F for foot. This is the abbreviation. So if we extend the AVR, so it will become minus AVR, and there is the minus AVL, and there are the vector results. So we found there are some new leads. They are AVR, AVL, AVF, and AVL, and A minus AVR vector result is lead 1. That is AVL minus plus minus AVR, and this is the lead 2. As we can see here, the same thing. These are the vector results, and this is the cardiac axis. Basically, our message is that cardiac axis is very close to lead 2. If we want to see the if we want to understand the ECG is perfect or not, we need to look at lead number 2. So let's understand how to basically understand axis deviation. Here are three ECG waves from one is from lead 1, lead 2, and lead 3. And here is a measure. If we measure this, lead 1, 2, and 3. Lead 1, R wave is a little bit higher than lead 2, and lead 3, R wave is a little bit smaller. So how we can understand the axis deviation and normal ECG? So if in the red color we are representing the left axis deviation, if R wave is much more higher comparative to uh, lead 2, and R wave of lead 3 is much lower, less higher than that. So this type of image represents left axis deviation. Same thing in the right axis deviation, but in opposite side. If the lead 3 is lead 3 R wave is much higher, or and lead 1 R wave is much lower or negative, this type of image we can understand this is an axis deviation. So summary is left is 1 and right is 3. So let's understand the parts of wave P, QRS and T. P wave represents basically atrial depolarization, and QRS indicates ventricular depolarization and atrial repolarization, and T wave indicates ventricular repolarization. But how we can understand? So here is some slight things. Depolarization means contraction or systole, and repolarization means relaxation, that is diastole. How this happens? Let's see in this small video. In this video, here we can see how the P and QRS happens. Just look at here.